Okay, we're going to talk about how to save your father's life. You know, if you're watching this video, you're probably at least 20 years old. You know, your parents did a lot for you, probably helped you with your education and everything. And so I'm going to tell you the most important thing to know to save your father's life. Most guys die from, most common cause of death for a man is myocardial infarction, okay, heart attack. And the best thing you could do, here's the main point of this lecture, by the way. Tell your father to watch Caldwell Esselstyn, MD, his video will be called How to Prevent and Reverse Heart Disease. This doctor right here, Caldwell Esselstyn, he has the best results of any doctor in the world. He's for real. I went and visited him and trained with him. I can tell you the other doctors who are the best in the world that know him. Caldwell Esselstyn, MD, he's out at the Cleveland Clinic. He had a whole bunch of patients. Best article is probably Journal of Family Practice 2014, I think it was in July. And he had about 89% compliance with his diet. And his patients had 99.4% of them no recurrent coronary events. Those are the best results in the world by far. There's nothing even remotely close. All right, so most men will die because of something related to atherosclerosis. First of all, it tends to cause erectile dysfunction, which makes them sad, all right, because the artery is going down to the Johnson. They're called the pudendals in Latin. That means like the shame, puderi. And anyways, the point is, those are only about 1.5 millimeters. It doesn't take a lot of atherosclerosis to plug them up. The arteries in the heart, typically about 3 millimeters, so those will plug up reasonably quick, especially at the bifurcations. The carotids are about 6 millimeters. It takes longer to start to plug those up, but that's a big thing for stroke. So coronary artery disease at branch points due to atherosclerosis. Also, pretty much the same risk factors cause atherosclerosis, heart disease, erectile dysfunction, diabetes, and high blood pressure. High blood pressure, hypertension. People think it's no big deal. It's a big deal because you're kind of screwed either way with high blood pressure. If your blood pressure is high, you'll have a tendency to bleed into your brain and get hemorrhagic strokes. And then if you overtreat your high blood pressure, you'll have a tendency to hypoperfuse your brain and become demented from lack of blood supply to your brain. So you're screwed either way with hypertension unless you, not guaranteed screwed, but you probably are, unless you really get your act together. From a metabolic point of view, diabetes and hypertension mean severe metabolic problems. And you want to take this path with Caldwell Esselstyn. It's your best chance to help get that under control. Just so you, for persons who, this is something that you don't need to tell your father, and you don't need to know about this, but for those of you who are more studious, more interested in going into the details, these are the big names in atherosclerosis prevention. Walter Kempner, MD, and his rice diet out in North Carolina. Nathan Pritikin and his EKG reversals, Ornish and his study from around 1990 with he had SPECT studies showing improved perfusion of the heart upon switching to a plant-based diet and some lifestyle stuff. Sloop right here is like, he's the best atherosclerosis researcher in the world, Gregory Sloop, MD. So anyways, the take-home point on this lecture, tell your father to watch Prevent and Reverse Heart Disease. It's the best thing he could ever do to prevent himself from having atherosclerotic coronary artery disease, and simultaneously he will minimize his risk of hypertension, stroke, dementia, and many other problems.